Vanakkam, good morning. In this video, we are going to discuss about the Erlanger Kaiser nerve classification. This is the important short note in the nerve physiology. It is a very important in the orthopedics also to study about the nerve injury. Erlanger Gasser classification based on the conduction velocity and thickness of the nerve fibers. So type A nerve fibers, the fastest conduction velocity, diameter is the 12 to 20 micrometer. So thickest nerve fibers. Conduction velocity is very high, 70 to 120 meter per second. It is a myelinated nerve fibers. Myelinated nerve fibers. It is subdivided into the alpha, beta, gamma, delta. So the type A nerve fibers more prone for the pressure because it is the thickest nerve fibers. So easily affected by the pressure. Type A alpha nerve fibers is a myelinated nerve fiber. Diameter is 12 to 20 micrometer. Conduction velocity is the 70 to 120 meter per second. Spike duration of the action potential is the 0.4 to 0.5 millisecond. Absolute refractory period is very less, 0.4 to 1 millisecond. It is supplies to the somatic motor, efferent somatic motor fibers act as the efferent somatic motor. Afferent fibers is carried from the proprioceptive receptor. Type AB nerve fibers are myelinated nerve fibers. Diameter is 5 to 12 micrometer. Conduction velocity it is 30 to 70 meter per second. Spike duration is the 0.4 to 0.5 millisecond. Absolute refractory period is 0.4 to 1 millisecond. It carries the afferent fibers from the touch and pressure receptors. A gamma nerve fibers, myelinated nerve fibers, diameter 3 to 6 micrometer, conduction velocity 50 to 30 meter per second, spike duration 0.4 to 0.5 millisecond, absolute refractory period is the 0.4 to 1 millisecond. It supplies the motor supply to the muscle spindle for the reflex activity and movement. Type A delta nerve fibers. Delta nerve fibers are myelinated nerve fibers. Diameter is 2 to 5 micrometer. Conduction velocity is 12 to 30 meter per second. Spike duration is 0.4 to 0.5 milliseconds. Absolute refractive period is 0.4 to 1 millisecond. It carries the afferent fibers from the pain, cold, touch receptors from the skin and periphery. Type B nerve fibers are myelinated nerve fibers. Diameter is less than 3 micrometer. Conduction velocity is 3 to 15 meter per second. Spike duration is 1.2 millisecond. Absolute refractive period is 1.2 millisecond. It is acts as the preganglionic autonomic fibers. Type P fibers more sensitive to the hypoxia because the type P nerve fibers having the more number of the oxygen sensitive channels. So it is more sensitive to hypoxia. Type C nerve fibers are unmyelinated nerve fibers. Diameter is very less, 0.4 to 1.2 micrometer. Conduction velocity also less, 0.5 to 2 meter per second. Spike duration is 2 millisecond. Absolute refractory period also 2 milliseconds. It is act as the postganglionic autonomic fibers. Pain, temperature, and some mechanoreceptors sensations carried from the type C nerve fibers. It is responsible for the local reflex responses, and type C nerve fibers are more sensitive to local anesthetics because it is non-myelinated, the thickness is very less, so it is more sensitive to local anesthetic agent. See this table, type P fibers are more sensitive to hypoxia because it has the more number of the oxygen sensitive channels. Type A intermediate susceptibility, type C is least susceptibility. Type A fibers are more sensitive to pressure because thickness is very high, so it is more sensitive to pressure. The B is intermediate sensitive susceptibility. C is the least susceptible to the pressure. Type C fibers are more sensitive to local anesthetic because it is unmyelinated nerve fibers. So it is thickness also very less, so easily susceptible to local anesthetics. Intermediate susceptibility are type B fibers. Least susceptibility is the type A nerve fibers. Summary of Erlanger-Kessel classification. Erlanger-Kessel classification based on the conduction velocity and thickness of the nerve fibers. It is divided into the type A, type B, type C fibers. Type A fibers are more thickness, more conduction velocity. Type B is intermediate thickness, intermediate conduction velocity. Type A fibers are more sensitive to pressure. Type B fibers are more sensitive to hypoxia. Type C fibers are unmyelinated nerve fibers. It is more sensitive to the local anesthetic agent. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.